Everyone. My name is Dr. Richard Horowitz. I am the co-host of the Healing from Lyme Summit, and it's my great pleasure to introduce to you my other co-host, Dr. Mariah Hinchey. Mariah, it's great to have you here today. Dr. Hinchey, for those of you who don't know of her, she is a Connecticut licensed naturopathic physician. She's been Lyme literate for over 10 years. She's a certified medical acupuncturist, and she regularly lectures at Lyme disease conferences across the country, promoting education for both physicians and the public on natural Lyme disease treatments and effective diagnosis and patient funding. Mariah, thank you for being here today. We have a great topic, I guess one that you and I have both discussed over time, but I think you're using a bit more, and I think you're going to be convincing me today of the role of Galectin-3. So we're going to be discussing today Lyme disease and pro-inflammatory cytokines and Galectin-3. And exactly what is Galectin-3? How does it calm the cytokine storm to heal from Lyme? We're going to dive into that today. So Mariah, thank you for doing that today and helping to educate all of us.
Absolutely. It's my pleasure. And again, thank you for that wonderful introduction.
Of course.
Um, so, and I want to put out there that this interview is on behalf of Econugenics and Clinical Synergy. So, I use a lot of a substance called pectisol, and the reason for that is because of a chemical called galactin-3. So, galactin-3 is a protein that is released when you have the onset of an injury or an infection or extreme stress. And what happens is galactin-3 acts as kind of a conductor of an orchestra. And so it recruits all of the different immune cells into the site of injury or infection, and it kind of tells them what to do and how to do it. And then it signals this pro-inflammatory cytokine cascade that further causes a lot of the damage and the dysfunction of the immune system that is seen in these infections, as well as causing most of the symptoms.
Right. So I guess there's a lot of published studies on Galectin-3, right? I mean, I learned about it a couple of years ago, and I even remember when I was learning about it, it was actually part of the biofilms, right? When they were talking about the structures, right, of the biofilms, which of course for me is becoming extremely important because of the role that dapsone combination therapy has played. Can you talk a little bit about apart from the inflammatory cytokines, the structure and how this all works? Like, why is this so important? Like, for example, we know about NF-kappa B inside the nucleus stimulates cytokines and the NRF2 pathway and NLRP3 inflammasome. So this, in other words, this is a whole nother structure, another pathway that may be causing some of this inflammation in Lyme patients.
Absolutely. And I'm going to come right back and talk about the biofilms, but I think it's important to understand this affects every single cell of the body, this galactin-3, and it's a driver of cardiovascular disease, a driver of cancer, a driver of fibrosis. It causes immune suppression. It causes biofilm formation, and not just the biofilms that we think of when we talk about Lyme and co-infections. It causes biofilm formation in the gut that various pathogenic and opportunistic bacteria use to evade the immune system too. And so, there's having elevated galactin-3 chronically can lead to autoimmune disease. It increases MMP9, which is collagenase, which is one of the enzymes that breaks down collagen and helps to, loosen the blood-brain barrier, as well as, the gut barrier and the tight junctions. So there are so many negative effects of having chronically elevated galactin-3. So like in a normal situation, you would injure yourself or have an infection, the alarm goes off, it recruits the immune cells, good inflammation would happen, and then it all resolves and you return to health. In a chronic elevation, it's like the fire alarm that just never turns off. And so you have this perpetual overreaction of the immune system and very heavy driving inflammation, biofilm formation, etc. So, without having a diagram, it's a little hard to explain, but if you picture like a pentamer or kind of like a five-pronged I'm thinking of like these little things that we had when I was a kid and you could connect the straws to them, but like it's kind of like a little circle with 5 spokes. And what happens is you have like individual spokes that when they become activated forms this pentamer, and then these pentamers kind of bind to each other and they form a lattice. So if you can picture a lattice, and that's kind of the backbone or the structure to the biofilm, which is kind of like this fort that these bacteria make to wall themselves off from the immune system. And it's one of the reasons why these infections are so hard to get to with a lot of the therapies that we have, like certain antibiotics, herbs, etc. So, one of the main points of dealing with these infections is exposing them to the treatment that we're using. And in order to do that, one of the things that we have to do is break down those biofilms.
So question for you, because I am using biofilm agents all the time. I mean, we started using them a couple of years back when it started coming out from John Hopkins and Stanford and Eva Shappi's group that biofilms were playing a role. I've mainly stuck with essential oils, cinnamon, clove, oregano oil, biocidin, stevia, which she had shown from Nutrimetics, peppermint oil. But you're saying like even just opening up the biofilms and using these, there still might be a benefit. And of course, I do check MMP9 in my patients for matrix metalloproteinase 9, and we see it in inflammatory joint disease with Lyme. So you're saying that this Galectin-3 is specifically when I see an elevated MMP9, or maybe I'm having a problem getting through the biofilm, even though we're opening it up, we might have affected the lattice correctly. So it's kind of still there, allowing the biofilms to form. Am I kind of understanding that correctly?
Yeah, exactly. And promoting like the pathogen adhesion to them. So even though, let's say, I guess I would look at it as kind of like a fort that maybe you have blown some holes into, using these other agents. And I mean, I love proteolytic enzymes as well for breaking down biofilms, but it's kind of like you can make these holes in there. But I kind of picture, for example, with Lyme, like a spirochete kind of like, maybe stuck underneath that lattice part that's still formed. And then another thing for me is like, oh my gosh, there's so many things that these patients have to take. And so I like to, sorry for the analogy, but I want to kill as many birds with one stone as possible. And what you're all going to learn is that there are like 7 main things, and they are 7 very important things that we want to do when we're tackling any of these vector-borne diseases. And it's amazing, like this Pectosol can actually hit all 7 of these things. So again, I try to put my patients on the least amount of things possible.
Oh, as opposed to myself, who loves to put them on 70 different supplements at once and then tell them, oh, I take them every day. What's the big deal? I'm swallowing 40 in the morning, 30 in the afternoon. Oh, you actually prefer the minimalist approach. Oh, I see.
Yeah. Well, but still, if you asked any of my patients, they're probably on 20 things. So, but it's 20 instead of 30.
Right. Now question, have you ever done yourself a comparison trial? Because I have used Pectosol. I've used them in the past. And I, just had to be careful with some of the patients with, Herx's or mast cell activation from citrus, et cetera. But you and I were discussing before we came on that the risk benefit, the benefit actually seems to be much higher in some of these people that are even sensitive to it. Can you talk a little bit about, like, have you tried different combinations, like you've given the Pectosol C, to address the Galectin-3 with or without the other biofilms? Have you seen larger Herx's? Like, have you tried that yourself a little bit as a naturopath to see what happens?
So here's what I would say. I started using Pectosol with some of my patients. I'm going to say probably 5 years ago. And I mean, obviously I was successful with what I was doing, prior to adding Pectosol in. But what I will say is that, and clinical synergy actually helped me to kind of like analyze this data back then. There was nothing formal, I have nothing formal, but what I would say is that I noticed a quicker turnaround in the, or the speed in which my patients were resolving their symptoms or decreasing the frequency and or severity of their symptoms. Pactisol is something that I will put my patients on in the beginning. So I kind of have like these stages. So like, I will go through micronutrients, food sensitivities, kind of like gut analysis, and I get an idea of how bad their gut is. Because in my opinion, if they have severe leaky gut, they're going to herx like crazy because they're just going to be reabsorbing all of the toxins back into their systemic circulation, increasing inflammation, increasing oxidative stress, cell damage, etc. And so I'm putting people on the Pactisol C because it's been studied and shown that it will bind the LPS anywhere in the body. And I'll talk about the technology and why, but specifically the LPS that is along the tight junctions, and it helps to decrease gut inflammation and it helps to heal the tight junctions, which can help the patients more effectively detoxify. And so, I'll just talk about it right now. So the Pactisol binds heavy metals, specifically arsenic, cadmium, lead, mercury, right? And we know that heavy metals can be incorporated into these biofilms. It helps to decrease fibrosis and enhance healthy collagen production everywhere in the body, from, the blood vessels to the ligaments and tendons and joints. It helps to increase natural killer cells in a dose dependent relation. It helps to break down biofilms, like I just said. Trying to think what else. Oh, it decreases interleukin 6 and interleukin 1 beta, two of the big cytokines, that are more downstream in this infection. And then it's also a weak binder, like I said, for the LPS, as well as mycotoxins. So it does a lot. And I feel like my patients go through less herxing and less severe herxing when I get them on this first before I put them on any sort of killing regime. So we actually, I made something called Herx formula, which is a combination of Smilax, glabra, cleavers, and high dose molybdenum, because my patients were herxing so severely and it was such an issue. And I would say the one thing that I've really seen change in my practice that I can say hands down is I hardly recommend the Herx formula anymore, because I don't have to, since bringing this Pactisol in, in the beginning stages of treating. So I don't know if
Right.
that answered your question, but
No, it doesn't. It was reminding me, when I was learning about, you're reminding me actually, when I was learning about Galectin 3 years ago, I love mnemonics, and I was remembering doing the A, B, C, D, EF, and it was like A, autoimmunity, and B, biofilms, and C, it actually has a role in cardiovascular disease, and
and
D,
cytokines.
diabetes, huh?
I said and cytokines for
And
C.
cytokines. And D
Yep.
was diabetes. Now, remembering actually the mnemonic, and F was fibrosis. And it was like, oh, yeah, this is like, it's a cool product. So, question about the leaky gut, going through this piece by piece.
Sure.
So, I've been using bovine immunoglobulins. There's different brands out there. There's SBI Protect, Mega IgG.
Mhm.
There's a bunch of them to heal the leaky gut. And it helps with the tight junctions. I've seen the studies on it. Are you using these in combination with it? Because it's fascinating. You're right. The LPS effect of binding it in the gut, it's a big deal for some patients who have severe leaky gut. And we find leaky gut in the vast majority of everyone we're checking at this point. Are you using them together and finding maybe better effects? Because I'm an alchemist by nature, by the way. I love combining. You
Yep.
know me well enough by now. You'll know this, but I love combining these things to try and get better effects. Have you tried combining them, or you just use it alone at this point for it?
So I would say almost every patient. I'm going to go out on a limb and say any patient that doesn't have some sort of intolerance to it
Hmm.
is on the Pactisol. Now, I would say maybe 15% are on SBIs. And again, I'm trying to go to the thing that I feel is going to have, farther reaching effects. And so SBIs are great. And for patients that I would say are more severe, for lack of a better word, or maybe have more severe dysbiosis, I will add the SBI in for
I
sure.
Great. And also for these people with candida, because candida also, right, has backbones and biofilms. So a lot of these people that may develop candidiasis and have a problem with it, these doctors that are just using nystatin or fluconazole or natural things, burn, breed, whatever. The problem is the candida is under biofilm also, right? So that also may be a place with the galectin-3 for the gut, like if you're dealing with leaky gut and candidiasis, which often go together. So you're using it in that population also.
Absolutely. And then, part of my protocol too, I think it was Tom Moorcroft put in front of me a couple studies about grapefruit seed extract like over a decade ago and how it agitated the round body or cyst form of the spirochete. And so I use grapefruit seed extract because I primarily use herbs and to accomplish that. But then also, I mean, grapefruit seed extract is one of my favorite antifungals. So it's kind of like that's doing a dual purpose. So using the G3M, breaking down the biofilm, using the grapefruit seed extract as an antifungal, I find to be extremely effective, even in patients that don't necessarily have fungal overgrowth in the beginning. But, you know, even like herbs are going, even though I think they have a less effect on the gut microbiome, being on a lot of these killing herbs for long periods of time, I do think that it chips away at the microbiome over time. And so it's important to make sure that we're not getting into the state of dysbiosis.
Question about the heavy metals, because again, we're finding the heavy metals in a lot of our patients. We screen them in the blood because the health departments don't love just doing a 6-hour urine DMSA challenge and chelating, so they usually want blood or hair, and we'll find it if we look hard enough. It's a little bit tough sometimes with some of these patients whose detox pathways are affected. I just had one actually today who she was loaded with mold and was upping actually her charcoal and clay with GI detox, and was really getting sick because her detox pathways couldn't handle it. Do you find, for example, it's a more gentle effect with the chelation? Like, have you actually measured combining, some of the natural things you can use for metals or using this alone for metals and seeing what the effect is? How do you measure it in your practice? Because you said earlier there are 8,000 published studies, on this with galectin-3. So have you seen this in clinical practice yourself?
So as far as like Galectin-3 itself, it's something that you can order through Quest or LabCorp. So you can get an overall Galectin-3 level, and then you can kind of gauge like, is this an issue, for this patient or not? And when I first started using it, I was doing that all the time because, I mean, let's face it, it's an expensive product and I don't want to use something that isn't necessary. And I was seeing a lot of elevated Galectin-3, and then I was seeing it normalize, after so many months, and then we would retest.
I didn't
So
realize you could do a blood test. I mean, the MMP9 is something I kind of do all the time, but I didn't realize you can actually check the galectin-3 in the blood.
yeah, yep,
Huh. Interesting.
yep. And it's,
So
I mean, and
that
it's
is actually something for people who are listening. That is one way to actually to figure out, right, whether the pectosol might be something, right, that you want to integrate in there, especially a lot of these really sensitive people with severe herxes. And it sounds to me like, and the woman I spoke to this morning, we talked about Smilax, Red Root, Bone Set. You were mentioning Smilax earlier, Saparilla.
Mhm.
I use these all the time, but she was still herxing like crazy. And now I'm thinking, this actually might be really interesting, to try it, because she also ended up with leaky gut when we tested her.
Right. Right. And so, patients that have extreme leaky gut, I'll take a month or two, if they're a chronic patient, which most of mine are. And I guess try to, the analogy that I use, and I'm sure you have too, many people do, is it's kind of like when they come in, the bucket's overflowing. And it's like we want to like stop the bucket from overflowing and just bring the water line down as much as we can by working on the gut, eliminating food sensitivities, eliminating sugar and processed food, and trying to deal with any sort of like opportunistic infections that we can see. And it's like as much as you can do without really getting to like those infections that are causing massive inflammation. But it's like, if you can create tolerance, because when you start killing things, the water line's going to go back up because of the LPS and the resulting inflammation, and all of that. So I'm kind of like, if we can make a little bit of room, what I mean, the patient will be able to tolerate the treatment a lot better. And by that, I mean have less severe and less frequent herxing.
Right. And, I think this is important because I think that's a lot of the problem with the Lyme patients. They are afraid sometimes of doing even the treatments that I'm doing because the herxes are extremely severe. So can you talk a little bit about more like what is the naturopathic approach, for example? Like I will sometimes use Spokana drainage remedies, right? If I feel like I need a little bit of lymphatic drainage or the apohepat, right? Or the Renalix or some of these to be able to detoxify. But it sounds like you're approaching this from several different perspectives. So how do you approach this in the really sensitive Lyme patient? What
Are
is
we
kind of
talking about herx or treatment in general?
well, herxing in this sense and how you're
Okay.
integrating the product into those patients?
Sure. So again, I guess I try to kind of pre-assess that like the worst condition somebody's gut is in, the more severe their herx is going to be. So, and part of this I learned from you. So, when you're herxing, what's really happening? You're driving an inflammatory cytokine response because of the toll-like 4 receptor. You're typically going into, a very acidic state. And so, the two main points, well, and then you have like, oxidative stress. So 3 main points are deal with the acidity, deal with the inflammatory cytokine cascade, and get antioxidants in there, right? So we have that, but then we also have, okay, detox. We need to bind the LPS, the fragments of the cell wall from the bacteria that we are killing. We need to bind them, stop them from getting reabsorbed into systemic circulation, and eliminate them from the body. So I know that, you talk a lot about Alka-Seltzer Gold with lemon water, minerals, using glutathione and acetylcysteine. But to answer your question, like taking a step back, like from a naturopathic perspective, I guess, it's kind of like doing all this background work where, okay, so for detoxification, all of the things that you need for phase 1, all of the things that you need for phase 2. Do they have genetic SNPs? Like what is going on? One of my favorite things to do is a micronutrient panel, and I look at the white blood cell so that I can tell what's in the cell, not just what's floating around in the bloodstream, because a lot of those nutrients that you need and a lot of like the detox biochemistry is like it's inside of the cell. So I go through and I look at what they're deficient in, and then we spend the first 4 to 6 weeks replenishing all of those deficient micronutrients. I've had several patients lately who have had like B12 levels off the chart in their serum, and then their white blood cell levels are completely deficient. So it's kind of like we can't just rely a lot on what's in the serum because that only tells us what got, from the tube that's really outside of the body into the bloodstream. It doesn't tell us what got from the bloodstream into the cell, which is where most of our processes happen.
Right. So this is similar to when I'm checking red blood cell minerals like RBC magnesium is where 99% of the magnesium is located. You only do serum magnesium, you're missing the majority. Same with red blood cell copper and zinc. So you're saying it's pretty much the same. And you're doing it, by the way, which functional medicine labs do you like when you're doing the micronutrient?
So for the only 2 that I know of that do white blood cell, but I'm also one of those people that like when I find something that works, I'm kind of like, I don't pay attention to the new things. So I know about SpectraCell and I know about Vibrant. And I typically am using, I would say almost exclusively Vibrant America's micronutrient panel.
Got it. Okay. No, that's important. I think it's good for people to listen to because when you have an important point like that, it's like, well, great, but where do I
where
use
do I
it?
go?
Right, because there's Doctors Data in Genova and all these other labs that are out there. So that's great to know.
Right.
Good. So it's Spectrum and it's Vibrant that you're mainly using. Great. So again, you're talking about these very sensitive patients binding the LPS. By the way, you are convincing me. I told you early on in this because I have used this before, and then I started having some sensitive patients, and I don't think I was tending to use it as much. And I'm realizing now, this is why, by the way, it's always great when we talk to each other and
I
communicate as
know.
healthcare. It's like, Okay, some of these people with bad leaky gut where the LPS may be playing a role, I've got to reintegrate this in some of these people. Like the woman I spoke to today was a Herx queen. I mean, she was complaining of horrible chest pain and shortness of breath and anxiety and brain fog and huge dizziness. And she just had started the dapsone just with doxyrifampin. We had not even gotten to dapsone to pyrazinamide, nothing. It was like the minute we were opening biofilms,
Yep.
and starting to hit the bug, she was herxing like crazy. And by the way, this is despite being on blocking NF-kappa B with NAC, alpha lipoic acid glut, stimulating NRF2 with curcumin, Oncoplex, sulforaphane, glucosinolate, resveratrol, green tea, using low-dose naltrexone, using low-dose melatonin to block NLR3 inflammations. I was doing everything I could to detox, and she was still herxing like crazy, and she had leaky gut. And it's like,
Yep.
how interesting that the patient I spoke to today almost sounds exactly what you're discussing. It's like, okay, it's a trick I had used, and I have to remind myself this is something for these really sensitive patients for the LPS, and to see if we can get them through the herxes and bind these.
Yep. And I mean, one of the reasons why I like Pactisol as well is that it's a weak binder, right? So we have so many binders out there. And when we're dealing with a chronic patient and we're going to have someone on these things for several months, it makes me personally nervous. And I know other practitioners will disagree with me, but I feel like if I'm going to be using something chronically, I want to stick to the weaker binders because they're not going to bind the nutrients and they're not going to bind all of the supplements and the things that we're trying to give them. And I mean, patients say, my God, it's a full-time job just to take all this stuff all day long. And if you have, activated charcoal and bentonite clay, and again, I'm not saying there's anything wrong with using them. I personally reserve them for extreme herxing and I'll use them intermittently. Or like if I have to use something like activated charcoal for orchotoxin, right? Because it's the only natural binder for it. Like that's different. But generally speaking, I love the Pactisol because it's a weak binder and I don't have to worry about it binding their nutrients or the things that I'm trying to give them to treat them. And then I would say my second favorite, not that we're talking about this, but I love chlorella because it's also alkalinizing, right? And what is Herx is acidifying. So chlorella is alkalinizing, but chlorella is also a good binder too for a lot of things, but it doesn't bind our nutrients.
Right. So in these mold patients, and I'm sure you're seeing as many as I am these days, I mean, I am forced to use charcoal and bentonite clay, whether it's GI detox or BioNY detox 2, whatever, which one I'm using. And for the trichothecenes, I've got to use optifibroline or glucomannan, whatever your type is. Usually those have to be taken, those binders, like the OptiFiber for the binding of the trichothecenes has to be at least an hour away. The charcoal clay with GI detox has to be 2 hours away. Do you have to pay the same attention to the binders when you're using the Pectisol C as far as like at least an hour away? You don't really have to worry about it.
No. So the way that I dose it is at least 15 minutes before meals. And that seems to work well. Another reason why I love it is I believe so much that it doesn't bind the nutrients that I actually put the herbal tinctures that I use into it. So I use a powdered form that tastes like lime. I joke and say it's the only thing that I have in my practice that tastes good. And it really is, other than like research nutritionals, orange flavored glutathione. Everything else tastes terrible. And so it's
You know,
like
I kind of like the OptiCleanse GHI from Zymogen. I actually
yeah.
think their protein shake with the GHI for gastric,
Okay.
hepatic, intestinal. I've used it for a year. When I was healing my leaky gut, I was having one of those shakes a day. And I tell people, you don't want to swallow all the gazillion supplements, throw them in there in a blender with ice
Yeah.
and frozen blue. So yeah, you're right, though. Most of them don't taste that great, but I'd say the OptiCleanse probably I've gotten away with. Yeah.
Okay.
But
But
no,
yeah,
it's
so
a good point. And I've tried the Pectisol myself because I have tried it before. So
have you tried the lime flavored one?
no, I actually haven't.
Yeah, that's the one that I use, and I use that one so that it masks the flavor or the bitterness, the nastiness of how all of the herbs taste.
Mhm.
So we joke if it's an adult, it's a limerita, and if it's a kid, it's limeade, and that's really kind of what it tastes like.
Right.
So
And you're dosing it how many times a day on the average?
So I do for an adult 1 scoop 3 times a day. And for a kid, again, depending on how much they weigh, typically it's about a half a scoop,
Okay,
which is
great.
about a teaspoon.
Okay. So, and again, the good news is no matter what they're taking, it sounds like you're doing it before meals, but it sounds like you pretty much can integrate this into most of the protocols without having to worry about it binding other things.
Exactly. Yep.
Great, great. So let's go through this again because this actually was quite important. So we're talking about binding to heavy metals, detoxifying other toxins, LPS, right? Working on the lattice, right, to break up that fiber lattice that's necessary for the biofilms. What's interesting, and now that I'm thinking of this, somebody really should be doing a study of combining these things and looking at them because the biofilms have become so important. Before I even put people on some of the antibiotics I'm using, I'll have them try the biofilm agents. I see some huge herxes in some of these people. The minute the biofilms are open and your immune system starts to recognize it. But I had not considered actually binding LPS at that point when they're having the herxes, thinking, okay, apart from working the phase 1, phase 2 detox and, maybe lymphatic drainage and everything else. Yeah, this is something it sounds like really would be a good addition. So the people that have mast cell that are sensitive to citrus, because it is for some people a problem. How sensitive do you see these people be to the citrus product? Is it a little bit? Most people can tolerate it. What's the issue with it, if any?
So I'll answer that in kind of a roundabout way. So I have had a couple patients come in who have had idiopathic hives where they've come in on seriously handfuls of various ways of blocking histamine, and they still have head to toe hives. Okay. So clearly like raging mast cell activation, also positive for tick-borne disease, right? And I'm just going to make this very simple. I have two patients that I'm picturing in my head. Both of them are on Pectisol. Both of them tolerate it wonderfully, and neither of them get hives anymore. One of them is also almost completely off of all of their like antihistamine sort of drugs as well, and still does not get hives. After having hives for 7 years straight, no one figuring out why the person
So,
had hives.
so what do you think is the mechanism? Because obviously we see a lot of mast cell activation, whether it's from mold or what Tanya Dempsey would call PIMCOS, pathogen-induced mast cell activation from
Yep.
Lyme. Yes. Why do you think it's helping? Because I mean, obviously we are seeing when I measure histamine, tryptase, chromogranin A, prostaglandin D2, I measure the mast cells. We are finding some just today earlier. I found a huge chromogranin A in one of these patients. Why do you think they do as well? Because a lot of my patients, they've got to be on an H1, H2 blocker. They've got to be on, Cytoquel or Histoquel from Research Nutritionals with, quercetin. They need a boatload of stuff for the mast cell. You're saying some of these patients actually you can kind of drive them on a simpler pathway. Why do you think that is?
So, I mean, let me be thorough with my answer, but still simple. So first of all, like this one gentleman that I'm talking about, 7 years, idiopathic hives, no one could figure out what was going on. So he had or has Babesia, Bartonella, Borrelia, right? He has all of that. No one had known that. I
The three Bs
diagnosed
that
him.
pretty much everybody has these days.
Right. So, and he came in on all of these antihistamines and his Claritin and, all of this stuff, right? So, I took my functional medicine approach and my approach to, to healing the body from these infections using Pactisol as one of the things, but like I also put him on quercetin and I put him on, all of the things, right? And I put him on high dose vitamin C with bioflavonoids to try to stabilize the mast cell. I also took him off all of the foods that he had IgA and IgG and IgE reactions to. So it's like it's not just the one thing, it's the whole, huge individualized approach. But I would say in my head, what I think is going on is that clearly the infections were driving mast cell activation syndrome. And so to me, in my very simplistic way of looking at things, okay, so that increases histamine and it increases the inflammatory cytokines, right? Which is going to lead to oxidative stress, cell damage, dysfunction, et cetera, et cetera. And it's that big giant ball of wax. So to me, it's kind of like these infections were the driving force of the mast cell activation syndrome, but they had also created other underlying causes like leaky gut, food sensitivities, accelerated degranulation of the mast cell, all of this stuff. So it's like, once we got a year, maybe a year and a half into his treatment, and he no longer was having any hives at all. I mean, from thousands of hives on his body. Um, we were able to then start decreasing the histamine blockers while continuing to like shrink the infection and do all of the other things. And like getting to the point of your question is that I feel like the benefits of the Pectosol, because of the way that it helps to heal the gut, decrease interleukin 6 and interleukin 1 beta, which are two of the inflammatory cytokines that are seen in mast cell activation, be able to bind the LPS, all of those benefits of the Pectosol, I think outweighed like the little risk that, okay, citrus contains histamine and citric acid can also drive histamine. So I just feel like it's kind of like with every other therapy or thing that we would look at in medicine, like in these instances, because you're getting all of these benefits from the Pectosol, they're offsetting that little bit of like exacerbation that you might see with citrus or citric acid.
Right. And you might start in someone who's sensitive that way because you're obviously feeling the benefits way outweigh the risk. You're talking about maybe instead of a full scoop in a highly sensitive patient, like a quarter scoop or an eighth, like start very low and maybe work them up. Have you had to do that in some of your highly sensitive patients?
Yeah. Yep. Yes, and one of those patients that comes in and says, "I can't take anything. I react to everything. I can't smell things. I can't, I have light sensitivity, sound sensitivity, smell, chemical, touch, all of that." You know that they're just going to be one of those patients that you have to kind of go low and slow with.
Right. Now,
Which is against my nature because I like to throw the whole kitchen sink and I like to just get people feeling better so that I don't lose them because these patients, as you know, they've been through the ringer and they have a short attention span by the
right.
time we get our hands on them.
Yeah. Now, do you want to just speak a little bit because we're starting to get to the close of it. But can you talk a little bit? Not all modified citrus pectin is equal, right? You're choosing this particular brand. And by the way, Dr. Isaac Elias did contact me years ago. He's the one who taught me about this.
Me too.
Yes. So obviously we've all learned from him on this. But explain why you're mainly using this one because they're not all created equal, are they?
They're not. And so citrus pectin in general would be a fiber that's not absorbable at all. It would stick in the gut, it would act as the binder piece, but you would poop it out basically. So Pectosol goes through this process, this enzymatic process that decreases its molecular weight. And so it's reduced to 3 to 15 kilodaltons, and then it's less than 10% esterification. And really what this means is that it's made small enough that it can actually be absorbed into the bloodstream. So it's not just working in the gut, it's getting into systemic circulation and doing all of these actions inside of your body.
Mm-hmm. No, that's great. No, you're reminding me now with this, it's like this actually in these really, really sensitive patients where, I mean, I'm able to control the herxes in many of these patients and push them through, but it's like, yeah, this is something that should be used. And by the way, the same cytokines you were mentioning, a lot of these are also overlapping the long COVID patients. We just got back one of Bruce Patterson's cytokine panels today where the CCL5 Rantes was high, the IL-4 was high, IL-6 can be high in it, VGF. It's the same cytokines they're seeing also in long COVID. That's why, by the way, why I knew to use glutathione in COVID early on, because I looked at the cytokines being produced and it was like, hold on, those are the same inflammatory cytokines we're seeing with Herxheimer reactions. Yep. So yeah, this sounds like actually between the healing of the gut and affecting the biofilms and affecting the inflammation, this is definitely sounds like something that definitely should be integrated, and I'm going to reintegrate it actually now that we've spoken, and that's why I thought this was really going to be a great reminder. Because I said to you before we started today, "Come on, Mariah, convince me of this," because I did use it years ago, and I'm trying to even remember. I think it was a few mast cell sensitive patients, and then you go in other places, but it's like getting back to baseline, reminding me of the science. That you've done a great job today. It's like, yeah, this absolutely makes sense. Going back to the biofilms and the fibrosis and the autoimmunity and the leaky gut and the fact that it's binding, LPS and taking down some of those inflammatory cytokines while working on the lattice at the same time. It's like binding metals. It's like
right. It's amazing.
Yeah, it's got a nice broad spectrum. I would just say now, I think the way I would do it in my sensitive patients is probably just start at lower doses and start smaller. Because I remember when, if I eat too much citrus myself, my wife's favorite comment for me is affectionately that I'm itchy Richie. Basically because she can take her fingernail and write, my name on my back and it'll come up in
Yes.
about 8 seconds because I'm so sensitive. And at this point, my allergic rhinitis and my asthma is not even an issue because I've learned to control the histamine and, get it under control by avoiding certain foods and healing my gut. By the way, healing the leaky gut for me was essential for this.
Huge. Yeah.
So, yeah, no, this has been a great reminder of why, Pectisol C, why this particular brand. It's got thousands of published references on it. Yeah, it's a great reminder for people out there. I'm glad we had this conversation today. And anything else you think that we've left off of the conversation that people should know about the way you use it, or I will measure now Galectin-3, by the way. And while apart from doing the MMP9, I'd forgotten you can do it. And by the way, so if it's high, it's like there you are.
Yeah.
You've automatically kind of a doorway of saying this is a patient who may benefit from it.
Right. So I would say two things. Number one is that there's a lot of studies showing Galectin-3 and COVID and long COVID. So that's just, it's important. It's something important to investigate. And there's definitely a role for Pactisol in resolving a long COVID or a very severe acute case of COVID. And that's published literature that is out there. And then I would say, forgot what my second point was. Oh, well, I'll leave you with that. You should investigate the
What's okay?
effects.
No, it's important because I mean, when I just did an overview of long COVID, we just submitted a new article in the medical literature about a week and a half ago. It's in peer review right now. I addressed the long COVID because I'm in the process of writing my third book, and I decided I was going to take a lot of these chronic diseases and break it down according to the MSIDS model, and I looked at long COVID. All 16 points on the MSIDS model have now been published associated with long COVID. So, it may play a role, of course, because inflammation is driving a lot of this. But of course, to be clear on this, I mean, a lot of these patients develop POTS dysautonomia. Their adrenals can be low. Their microbiome is thrown off. They reactivate infections. I can't tell you how many Epstein-Barr virus reactivation and HHV6 reactivations I've now seen in my chronic Lyme patients after they've gotten COVID. I mean, I used to check it years ago. I'm checking it routinely. Just today, 2 of them came back positive. So the long COVID, actually, it's kind of an MSIDS overlap. But what you're saying is they did publish that some of the inflammatory response, right, can be addressed with it. Obviously, dealing with dysautonomia and brain fog, I mean, they're looking at different ways of still dealing with it. We still find in some of these patients, they do respond to high-dose glutathione the way they do with Lyme, with Herx's. But I think there's a lot of the mechanisms they're still working out. But it's good to know that for those people out there listening, this is actually something you may want to consider in your arsenal, not just for chronic Lyme, but for many of these inflammatory diseases like long COVID. So,
Right.
yeah, no,
I remember what my second point was. My second point, we were having a conversation earlier in an interview today, and it was like, okay, well, what do you do? What about a patient who has tick-borne disease? They're testing positive, but like they don't have a ton of symptoms. And it's like, okay, well, we all know that these are inflammatory infections, right? So they create inflammation and they live off of basically the results of those chemical messengers of inflammation. And collagenase is a perfect example, right? So MMP9 breaks down the collagen, feeds a spirocate. So it's interesting, right? There's not a lot that us medical professionals agree on, but I would say the one big thing is that pretty much all chronic disease starts with inflammation, right?
Yes.
So if you look at how Pactisol is able to affect almost every single chronic disease that's out there, whether it's cardiovascular disease or it's diabetes, what's the common denominator, right? It's all the inflammation.
And by the way, these are all published. You said there's thousands of peer review articles,
There's
right?
8,000.
Yeah.
And it's all aspects of health. I mean, there's a lot of studies on prostate cancer and breast cancer, as well as cardiovascular disease, other metabolic diseases, fibrosis. I mean, there's a ton.
That's great. That's great. This was wonderful. I think very convincing, really excellent kind of review of the scientific literature to explain to people. And, I was hoping when I was co-hosting this, it's not just about sharing with people, obviously, what I'm doing and what you're doing, but learning from each other, right? I mean, that's the beauty of this, is we all learn from each other. And sometimes things we used years ago that we get to come back to, and it's like, oh yeah, that's right. Doctor, he had taught me about this and I started using it. It's like, now that I'm so big into biofilms and realizing how important it is with the rest of it, it's like, I got to go back and I have to try this. So yeah, I'm going to look at the Pectisol C and the modified citrus pectin and start using it in some of these really inflammatory patients. I think you did a great job, and thank you for sharing all this information today.
Thank you.
Yeah. So for those of you who've been tuning in, I've been co-hosting, speaking to Dr. Richard Horowitz and my co-host, Dr. Mariah Hinchey. We are both co-hosting the Healing from Lyme Summit, and you're hearing today about the role of Galectin-3 in inflammation and the role of modified citrus pectin and Pectisol C. Great talk. I think people are going to get a lot out of this. And thank you again for joining me. We've been really having some amazing interviews with people. I think the Lyme community is just going to go wild when they realize that we've had some fabulous interviews with some real great experts. So thank you for sharing this. I think this is really going to be a key thing that's going to help people. I hope you have a great weekend and that things go well. So thank you so much.
Thank you. Take care, everyone.
Okay. Bye-bye, everyone. Hope to see you for another Lyme Summit very soon.